Hey guys, this is Charity Stanley, and today we're talking about the legal implications of psychiatric nursing. Okay, so with psychiatric nursing, it's kind of a unique aspect of clinical care because the person is not always able to give us consent. And in fact, in many cases, we will actually have to put the person into a facility without their consent because they're at risk of hurting themselves or others as a result of the psychiatric illness. However, when somebody is put into a facility, they retain all the civil rights that are afforded to all people, except the right to leave the hospital in case of involuntary commitment. If the person has come to the facility and said, "Hey, I would like some help, I'm signing myself into the facility," then they have the right to sign themselves out of the facility unless it is transferred to an involuntary commitment. And the only reason that would happen is if the person had made statements that they were planning to hurt themselves or somebody else um, when they leave the facility. So we also have the Mental Health Patients Bill of Rights. So be sure and look that over in your textbook. Now, involuntary hospitalization. With an involuntary hospitalization, the patient is committed at least for 48 to 72 hours. They can be detained and held in a psychiatric facility. And depending on how full the facilities are, they may actually end up detained in an emergency department for that period of time. And after that, if the patient is still a danger to themselves or someone else, then a hearing may have to be conducted to determine what further treatment needs to happen to help them no longer be a risk to themselves or other people. There's also similar laws in place for people with substance abuse issues. And frequently, when somebody with a substance abuse problem is hospitalized, they will be put on, especially if they're using IV drugs, they'll put on a policy called an IVDA, IV drug abuse policy. And they will lose their cell phone, they will lose phones within the room. They're not allowed to have visitors for a certain period of time. Then those visitors have to be checked in and checked by security to ensure they're not bringing illegal substances into the hospital. So with this, it's important that you recognize that involuntary hospitalizations are needed and they do happen. But as soon as the person is released from the hospital, their civil rights remain intact. So voluntary hospitalization, I sign myself in, I can sign myself out unless I'm a danger to others. So the committed client may be required to take medications and improve rapidly. And the person, once that they are released from the facility, is no longer a danger to themselves or others. Frequently, they will get back on their own, not take the medications, and then become dangerous again. So mental health clinicians can be held liable for criminal actions of client. Now, what this means is that it is better to err on the side of commitment if you are uncertain if this person is stable and ready to leave the facility. Some people will be given a mandatory outpatient treatment. This would be like an intensive day program. So continued participation in treatment and require that they take prescribed medications, that they are getting their life back on track, keeping appointments with healthcare providers. And these are called conditional release or outpatient commitment. So before these are mandated, the person is given several opportunities to do this kind of thing on their own. And if they do not attend, they can be picked up and put into an actual inpatient facility. If a person shows consistently that they are unable to take care of themselves or take care of their day-to-day finances, there's a couple of different legal options. So this is a person is established a guardianship over or conservatorship. Now, this has gotten a lot of media coverage in the press recently due to Britney Spears. For a while, she was having significant psychiatric issues, shaving her head, different strange behaviors that was happening. And she was not able to control her own financial aspects of her life, make decisions herself. And so the conservatorship was given to her father, who made her decisions. So Britney Spears, once she had the guardianship in place, could no longer vote. She could no longer enter into contractual obligations. She couldn't go buy a car. Her father had to act on her behalf to do so. So this is the inability to act in your own best interest. So this person will speak for the client. Now, if somebody does not step forward and take the conservatorship, the legal guardian for this person, there are conservators who can be assigned from the state. So once you enter in through the conservator guardianship process, then somebody from the state can actually manage their affairs. Ideally, people are kept in as much of an environment as normal as they can be. So we want to keep them in the least restrictive environment. And we want to keep them free of restraint or seclusion. Seclusion can cause psychiatric problems in and of itself for a long period of time. And we want to keep people where they can move around, make choices, and have a day-to-day existence that is most normal as possible. So restraint, this is going to be direct application of a way to stop somebody from moving around. So this restraint can be human. So we can have a person holding each limb down, having somebody else hold the head, and then another person to give medications through human restraint, or it could be a mechanical restraint. So you often see the wrist restraints that are tied to the bed rails. And in the past, we used to use them a lot more within the hospital environment, but that has changed, and we want to keep people in the least restrictive environment as possible. Now, those cloth restraints can be broken. They also, especially in psychiatric institutions, will have leather restraints as well. Seclusion is locking somebody in a room with a security camera for direct visual monitoring. And there is nothing in this room that they can hurt themselves on. Potentially, the seclusion rooms will even have padded walls. So if the person attempts to throw themselves against the wall or hit their head on the wall, that it's padded so they are less likely to cause damage. So you only want to put somebody in one of these rooms when they are dangerous and very aggressive, to give them time to regain their composure, to give them time to be able to calm down. And then you want to reintegrate them with the group as soon as it is safe to do so. So short-term use of restraints, again, restraints is an area where documentation is always double and triple checked. So make sure that your documentation is stellar with restraint use. You want to have a face-to-face evaluation within at least an hour. And then after that, every 8 hours, every 4 hours for children. You have to have a separate physician order for every 4 hours of restraint. This means that the physician you can't just continue the order. The physician has to be notified every 4 hours for a new order, and that's every 2 hours for children. Assessment has to be documented by the nurse every hour to 2 hours, that you gave them the opportunity to use the restroom, that you gave them the opportunity to drink or to eat if necessary. So close supervision for that first hour, that's when people are most aggressive, is during that first hour. And then afterwards, explain why they were put in restraints or secluded. So debriefing session after they've been released from the restraints or the seclusion. HIPAA. It's HIPAA. That's one mistake that a lot of people make, is they think it's HIPPA. It is not. It is HIPAA. HIPAA is the Health Insurance Portability and Accountability Act of 1996. So prior to HIPAA, so Peyton Manning had damaged his knee, and he was at St. Mary's way back in the day before HIPAA. I'm aging myself, I know. But I happened to be working the day of the game where he injured himself, and he was brought into St. Mary's. And every single floor had a copy of his x-ray up on the x-ray board. So this was prior to HIPAA. He was listed as a no-name patient, but everybody knew who he was. And everybody knew what room he was in. So that would today, having those x-rays up everywhere on all these floors that did not have him on it and did not need access to that information, that would be a violation of HIPAA. Okay. So civil fines and criminal fines in prison sentences can be enacted for a violation. Now, with the exception, there is a duty to warn. Okay, so this is called Tarsoff's rule. Duty to warn third parties. So if somebody has said in a confidential environment that they are actively going to hurt somebody else, that person has to be warned that this is a potential, so they can take necessary changes to be able to protect themselves. The insanity defense. So insanity has a legal meaning. It really does not have a medical definition. We do not talk about people as being insane. Insanity is a legal definition that is determined from the legal community. So there's 4 versions of the insanity defense that are, all these are due to some kind of mental disease or mental deficit. McNaughton's rule. The person did not know that the act was wrong. And so that would be a low functioning person who low IQ wasn't able to know that the act was wrong. It was an irresistible impulse. Okay. They couldn't control themselves. So they walked in and were temporarily insane when they saw their wife having an affair with another man and killed that man. That would be an irresistible impulse. So substantial capacity. The person lacks substantial but not total capacity to know the act was wrong. So they knew it was wrong, but they did it anyway. And then Durham is the person's criminal conduct is excused. So several states have abolished the insanity defense. Tennessee does still have the insanity defense. Argument is that the verdict stops the legal system from having any responsibility. So what do you do with somebody who's criminally insane? You stick them in a facility. The thing is, in these facilities, they do not always receive the psychiatric treatment needed. So depending on which facility they go to. There are several facilities here in Tennessee. One is in Memphis, one is outside of Nashville, and one is in Chattanooga. Moccasin Bend is the one in Chattanooga. And the officers that work at these institutions actually have special skills in being able to work with patients who have difficulty telling right from wrong and that have history of violence. So nursing liability, it's important that you provide safe care, legal care, ethical care. If this patient, if the person that you are treating today, that you are caring for today, is somebody who has committed crimes, they are in fact a person first and foremost. So you care for them in that manner. Professional guidelines, there's a code of ethics. It's important for you to know where you stand because you will be expected to care for the victim of the crime with as much compassion as you will care for the perpetrator of the crime. So also ways to avoid liability is within your textbook as well. And torts. Torts are wrongful acts that result in injury, loss, or damage. So you can damage somebody without meaning to. So that would be negligence. Negligence is going to be, I didn't do what I should have done for the normal nursing standard of care. Malpractice, I did something I shouldn't have done for the normal nursing standard of care. So you have to have several different factors in place to prove malpractice. First is you have to have a duty to act. By having a duty to act, that means that you are on duty, you are working as a nurse, and you breached that duty. Now, if you are on your way home from work and you are not clocked in, you have no duty to stop and help somebody in a car wreck legally. Ethically is something else, but there is no legal duty for you to stop and help somebody if you are not currently working as a nurse. Okay. There has to be injury or damage that happened as a result of an action or an inaction that you directly caused. So you have to have all four aspects to prove malpractice. Intentional torts. There is a difference between assault and battery. Assault means I put you in fear for your life or that you would be hurt. Battery is actually touching you. False imprisonment is I made you stay without having a legal reason to make you stay. I wouldn't let you leave when you wanted to leave. So there's three elements to prove liability. For intentional torts, it has to be a willful voluntary act. The intention was to bring about consequences or control or injure somebody. And the act was a major factor in the injury or in the consequences. So ethical issues, ethics is a branch of philosophy that deals with human values, and the way that you behave is frequently based upon the things that you value. People are good or bad. Their motives can be good or bad. Their actions are often based upon their values. And there's some overarching philosophies. Utilitarianism. This is where you make the decisions based on the greatest good for the greatest number. So utilitarianism, your decisions are based on the greatest good. Deontology, your decisions are based on whether the action is right or wrong morally. but you're not looking at the consequences. So several principles look at how we guide the deontologic beliefs. So autonomy, a patient has the right to independence. They have the right to decide for themselves what they want, what treatments they want, what treatments they do not want. Beneficence, they have a duty to benefit others, promoting good. Non-maleficence, it's the requirement to do no harm. Justice, being fair. Veracity, being honest with your patient, being truthful. Fidelity, the obligation to honor commitments and contracts. Ethical dilemmas in mental health. There's really no right answer in many ethical dilemmas. So most of the dilemmas involve the client's right to autonomy and to make their decisions about if they stay or if they go. But many times a patient is not safe to let them leave the facility because it is unknown if they will hurt themselves or hurt somebody else. So important factors in ethical decision making. Big thing is to gather information, clarify values, figure out which values are most important to you or to the organization, identifying different options, looking at legal constraints. What can we do? What can't we do? Sometimes, if you cannot find a way to legally keep a person in a facility, you have to let them go. But in doing so, you need to notify other people with the Tarsoff law to be able to allow them to best protect themselves as well. And then you review and analyze the decision and see how you could improve your decision-making process within the future. So if you're unsure about the different ethical issues or the legal issues surrounding mental health care, then it's important for you to seek mentors that you can talk to, other nurses who are more experienced, your managers, to be able to figure out what is the best course in a situation involving mental health care for patients. Thank you very much.